for some peace of mind. But TikTok said a gator drove a jeep through the blinds.
Okay, wrong intro. Sorry guys. I was kind of all over the place, getting ready for some stuff and reminding myself we have a doctor's appointment today. So remember that you're going to have to stop uh, and, be able to function in another capacity. So do remember that. Now, it does look like we are getting into the witnesses. I did watch a little bit ahead, and it does look like we are getting into medical witnesses that cared for Lindsay. And I think that this might be hard in the sense that if you've ever struggled with not feeling heard in a medical capacity, uh, it could be definitely emotional, be above and beyond the baseline tragedy that is this case. So gentle warning that, if you have been dealing with a chronic condition or things like that, I do try to put emotional, like little warnings about the absolute subject matter, but I do feel like especially for me, I know that the next couple days as we are going through, all of the doctors who attempted to treat Lindsay, this could be, kind of unexpectedly traumatic and hard for those of us who have been dealing with chronic medical issues or feeling unheard, by the medical establishment. So be mindful of your mental health. I always remind you of it with a subject matter. But I am finding that this case is particularly hard on a personal level as well, with sort of feeling unheard by the medical community. So I do like to, once I become aware that something's bothering me, I like to share it in case someone else has a difficult time with their feelings. But let's get into this. I hope you guys had a lovely weekend. I had a pretty productive one, and it was uncomfortable, but in a good way. So, if that makes any sense, it was uncomfortable, but in a way that you're growing, which is not the most comfy place, but is definitely Jason J. Now, she hasn't pled or kind of officially said, that she had a mental disease or defect. What, what the defense kind of hinges on is that, she was undiagnosed for bipolar since her 2nd childbirth. And all of the sort of doctors that were covering her, or at least the defense's theory, all the doctors that were covering her failed to notice that not only that she was not dealing with postpartum depression kind of in a generic term, but postpartum induced bipolar, which is again something I didn't know was even possible, but apparently is something medically documented and completely different that or not exactly the same, but needs to be treated differently than postpartum depression. And Lindsay was given, again, according to the defense theory of the case, was given SSRIs, which are very verboten if you are dealing with someone with bipolar disorder. According to the civil suit, one of the things that one is not supposed to do when treating a bipolar patient is give them SSRIs because they can interfere with the brain chemistry. Look, I'm not an expertologist, but basically, because the postpartum bipolar was missed and treated with SSRIs, and it appeared that she got better, no one was aware that with a 3rd pregnancy, there is a tendency, if not a a factual certainty, that the postpartum, bipolar can come back again. And they treated her with an incredible amount of SSRIs because they weren't aware that she had bipolar, causing so many different side effects and issues because they were treating the wrong thing. So that's always been the defense's theory of the case. Not so much that she um, was insane, but she was she lost touch with reality because of not only the bipolar, postpartum bipolar misdiagnosis, but the insane cocktail of drugs that they had her on, where they were weaning and increasing, and usually you're tapering down on one medication and going up on another, so the side effects can be kind of confusing. So that's kind of the general defense outline of the case. I will be very honest with you guys and transparent that I didn't think I was gonna cover this case. I am honestly shocked at the amount of empathy I have and sympathy I have for Lindsay. I was afraid I was not going to be able to feel an iota of that, and I honestly, didn't wanna cover the case if I couldn't at least cover it with humanity, and I wasn't sure I was going to be able to do that. And I've been really shocked, that the lack of humanity is coming not from me, who where I thought it was going to be coming from, but from, the Commonwealth, and I don't know what justice looks like in this case. I honestly don't know. I don't know what it looks like, but I know that it didn't need to be presented in this way. I don't know if Lindsay should go to jail. I don't know what the punishment should be. Part of me feels like she's already in her own jail, so wherever we put her, I'm not sure. I don't know. I don't have all the answers, and I'm not gonna come up here and pretend I do, but I have been shocked at the humanity I have found in myself when I didn't think that there would be any, and the shocking lack of humanity in the justice system, in the way that this case is being presented. But let's dive into this and get going. We'll be going until about 1 PM, and then I have to take youngest, most feral to the doctor. So we might be on our own timeline, again this week, but I do intend to hopefully have another afternoon session when we get back. But we are expecting some pretty big storms, so it is all in the hands of fate.
All right, jurors entering.
Oh, and one of the other observational things that I want to be aware of, because I will be looking at it, is as we move away from, describing the children, I do think that we will see a more active and alert Lindsay, and I think that that's not, completely confusing if you have an ounce of humanity and compassion in you. But I do expect that there's going to be a lot of commentary on the fact that, this morning she's looking alert and, shoulders back, sitting straight up. I think there is going to be commentary about that. And it doesn't shock me that, as they are talking less about her children and more about her own personal injuries, which I'm gonna wager to say she doesn't give a real rat's ass about, given that she signed a DNR, and according to her own counsel, she doesn't wanna be here, euphemistically. I think that there is going to be some unsympathetic chatter about her difference in ability to be attentive and things like that, and I will be interested to see if anyone comments on it.
Hear ye, hear ye, hear ye. All persons having anything to do before the Honorable William Sullivan, Justice of the Superior Court, now sitting in Plymouth, within for the Commonwealth. Draw near and give your attendance, and you shall be heard. God save the Commonwealth of Massachusetts. This court is now in session. Please be seated.
Good morning, Your Honor. May I proceed?
Yes, please.
Your Honor, before the court today, we have the continuation of the jury trial in the matter of Commonwealth versus Lindsay Clancy. Ms. Clancy is present. She is represented by attorney Kevin Reddington. The Commonwealth is represented by Assistant District Attorney Jennifer Sprague and Assistant District Attorney Shannon Buckingham.
All right, thank you, Madam Clerk. Well, good morning, everyone. I hope everybody had a restful weekend. So what I want to do is just kind of tell you, first I'm going to go through those questions, make sure everybody was able to follow my instructions. Then I'm going to go over what today's schedule is, and then we'll return to the Commonwealth's presentation of evidence. All right, and so let me ask those questions. First question, has any member of the jury read, seen, or overheard anything from any source about any aspect of this case that would affect your ability to be fair and impartial? All right. Next question. Is there any other serious matter or concern bearing on your service as a juror in this case that anybody needs to bring to my attention? All right. Again, thank you for following those instructions. Now, today's schedule. Let me say first thing about schedule. I know I haven't always been completely correct on some of the schedules we follow, but I want to just let you know.
Does Massachusetts, like, is there a union thing? Do we just work 10% of bank hours? Asking for a friend, because I thought that I was going to a New England court, you know, the land of Puritans and type A personalities. And I swear to God, I've had more like time space continuum adherence from Southern courts. So someone explain this to me.
Those decisions about the scheduling is on me. All right. And sometimes I have to take into consideration other factors or things that are going on. So what I really wanted to tell you is that don't speculate why we might go a little late or a little early on any certain days, but certainly don't hold it against either side in regards to that. The person who's making those decisions or that decision is me. All right. So you should be aware of that. So that being said, the thought is today, we should go into the afternoon. All right. And if that changes, I'll let you know. And what we're going to do at this point, we're going to return to the Commonwealth's case. And with that, Commonwealth, call your next witness, please.
Your Honor, the Commonwealth will call Michael Snyder.
Is it another first responder? Because I can't with the Commonwealth anymore.
While we're waiting for Dr. Snyder, can we just approach?
Oh, sure, yeah.
Thank you. Apologize.
Oh my God, it's evil mini Lex Luthor. He's fun-sized and he's here to ruin your day. He got shrunk because of the Krypton. You know, when you wear kryptonite as a ring, there are side effects. What in the miniature Dr. Evil is going on here? Sorry, Dr. Schneider, we aren't calling you. I have no idea. I honestly, I'm still not recovered from the gym shrinkage medical announcement headline I did. So.
Good morning. Do you solemnly swear that the testimony and the evidence that you shall give to the court and the jury will not find between the Commonwealth and the defendant? Thank you. You may have a seat.
And all I am thinking when I look at that blazer is ruffles have ridges to pick up the dip. Look, what can we stop with the ruffles, ladies? The ruffles, the puffy sleeves, the shoulder pads. Could we all say no to the 80s collectively from a friend trying to help you named Mo?
Watch your step, please.
All right. Good morning, Doctor.
Good morning.
All right.
May I inquire?
Attorney Buckingham, please.
Thank you. Good morning, sir. Could you please tell the jurors your first and last name?
Yep, Michael Snyder,
Do you mind spelling your last name for the record, please?
Snyder.
And how are you employed?
I'm a physician at Beth Israel
And how long have you been a physician?
since 1998.
Can you tell us a little bit about your educational background?
So undergrad at UMass Amherst, I did medical school at Tufts University, and then I did my residency in emergency medicine at Boston University.
Okay, since look, I'll call it out. Let's be real here. Okay, Madam Commonwealth Attorney, look, I know I've called you a young Janet Reno and, well, a roadie for, Motorhead. In the name of Lemmy, we pray. Uh, but might I posit, somewhat autistically, but, look, if you have a bald spot here, do you know what those of us afflicted with noticing are gonna do? The bald spot being covered up by a bow. There are ways to deal it with thinning hair, and I say this as a person who understands how looking at the mirror and not seeing the person you wanna see can be incredibly hard. But if you talk to a good stylist, they will give you ideas that aren't a giant bow because it doesn't stop me from noticing your female pattern baldness. It in fact draws my eyes to it. There are cute hairstyles and honest to God wigs that don't bother me, and I have all of the sensory issues. There are ways that you can feel confident about yourself that don't involve being a, well, devoid of, compassion human and putting a bow over a bald spot.
And how long have you worked at Beth Israel?
Since 2014, 12 years.
And do you primarily work in the emergency department?
Yes.
I'm going to draw your attention to January 24th of the year 2023. Do you recall working in the emergency department on that day?
Yes.
And in the evening, were you made aware of multiple pediatric traumas that were coming into the emergency department?
Yes.
Fuck no. We're starting off on a Monday with the kids. Are you kidding me, Commonwealth? Again, I understand that there are schedules and things like that, but strategically, if I were the Commonwealth, I would never start a Monday off with a highly emotional, especially after the emotional ringing I gave the jury last week. I would ease them in. God forbid, and it's not strategically great, but I would go back to some first responders. Again, anything. I would ask random CVS, but to start a Monday morning with this after you have already emotionally wrung out the jurors, this is not going to have the impact that you think it's going to have. In fact, I am now actively, like, kind of divorcing myself emotionally from this witness. And I don't doubt that many of the jurors who are trying to protect themselves and get through another 4 to 5 weeks of this trial will not have said, "Oh my god, they're gonna talk about the kids," and immediately do what I just did, which is, "We are here for the facts. I am going to disassociate with any emotions that this witness was intended to bring out in me." And I think that is where the Commonwealth has really overplayed their hand, and they're starting Monday morning with this. I cannot tell you how strategically I disagree with this.
And when you are made aware of people coming in, how does that occur?
So we'll typically get a call on the EMS phone that something's coming in that they want us to know about up front.
And do they provide you with some basic background information about what's occurring or what occurred on scene and what's occurring during the transport?
When possible, yeah.
And when the emergency personnel, the EMTs or paramedics arrived at Beth Israel, there were 3 patients, correct?
Correct.
And you were assigned to treat 1 patient?
Correct.
Do you recall which patient that was?
Cora?
And prior to EMS arriving, did you learn more about Cora's presentation and what was occurring?
Yeah, so we had heard that.
Do be mindful, you guys. I didn't anticipate that we would be going into the children. And while there is fact patterns, that there are facts that the state does need to prove in order to meet their burden. This all could have been stipulated to. And thank you to this doctor who tried, I am sure, and carries all of the patients that he wasn't able to help with him. Why do we have to make him relive this? I will never understand.
All 3 were in cardiac arrest, And the core in particular, they were still working on doing CPR and doing what we call pediatric advanced life support, so medications to try and restart the heart. And they also mentioned that they had used what we call a defibrillator to shock the heart to try to restart it. And they were still doing CPR when they were arriving.
And is this information important to you as you're assessing a patient coming into the emergency department?
Yeah, it's important to know, what things look like in the field, how long the patient might have been without a pulse, or how long they may not have been breathing for, so we can kind of expect or know what.
Having said everything, this man seems like a really good doctor, and I'm sure he's had to tell many people not so great news. And he seems like I never wish that people carry the emotional weight of patients they couldn't save, but people that honor the loss and the gravity of what their news means, you can tell that this man deeply understands that when he walks out of, the ER or the trauma room and he has to tell a family that he did all he could, but that there just wasn't anything else. And this is the part that I think is gross. I feel like a voyeur on this man's personal struggle to deal with the crap that his job constantly sends his way and still be a good person. And it pisses me off that we have to be here. Now, if he wanted to share with us his fireside chats, I would be there quick, fast, and in a hurry because his tonal quality, something about his voice makes me think, like, "Oh, this is a warm hot chocolate for my brain." Like, it's just a cozy mug of hot chocolate. I don't know, I could listen to this man read a phone book, but what I don't wanna do is watch him relive this against his will.
Injuries to look out for, what we can potentially reverse.
And were you aware of the age of Cora?
Yes.
And she was 5, correct?
Yes.
And as far as the medications,
Holy God, what is the pterodactyl attacking the courtroom? Also, Gabby, I know that we're on cation, and I just wanted to be approachables. I'm approachables. I have been reliably told that these are the only eyebrows that one can wear while being a serious YouTube true crime wine mom. So I am just trying to learn by example.
that you were aware of, what medications had been provided?
So prior to coming to us, she had been given epinephrine, which is the primary medication we use in a cardiac arrest.
And do you know how they had administered that medicine to her?
Yeah, so she had what we call an intraosseous device in her right tibia. Sometimes it's very difficult to get an IV in, so we can go directly into the bone or the bone marrow.
And were you aware of whether she had been intubated en route?
So she was not intubated en route.
When she arrived at the emergency department, were you there to greet the ambulance?
Yes.
And what happens when a patient comes in through the emergency department via ambulance?
So when the patient first comes in, we immediately have our team, start to sort of take over care so there's no gap. And then we also get a sign out from the paramedics and EMTs and any other staff that had been involved in the case.
And do you and your emergency room staff then perform your own initial assessment of the patient?
Yes.
So what do you do for that?
So initially, we sort of go through our ABCs, airway, breathing, circulation. So initially, focusing on the primary things, such as making sure we're getting air and oxygen into the patient, keeping the heart going, so continuing CPR at that point.
And as far as Cora went, did you observe that she was breathing?
So she was not breathing on her own.
How about the heart? Did you observe that her heart was beating?
There was no heartbeat.
How about her physical appearance? What observations did you make of her physical appearance?
Tiny baby Jesus Almighty, in his name, I thought I was the autist. What are these fucking questions? I swear to God. I'm going to go off screen and take my own puppy kitten break because the amount of profanity that just wants to come out of my mouth when we all know this. I mean, logically, we don't need it pieced together moment by moment, like we're in fucking Twilight, and we have to learn that Bella came home, went to Safeway, and then did her trigonometry homework. No one cares. And I mean that sincerely, but damn it, this man's already dealing with shit. Why are we watching this? Why are we asking him banal, ridiculous, stupid questions that aren't illuminating anything?
So initially, when she had come in, some of the things we notice is sort of a blue tint to the skin, which typically, we can see when there's less oxygen or lack of oxygen. And then the other things on a quick survey is there was some areas of bruising on the neck and around the eyes, called petechia, kind of little bleeding episodes of bleeding under the skin, and I believe a small amount of blood coming from the nose.
Were you able to make observations of her hands or other parts of her body?
So the hands definitely had that, what we call cyanosis or blue hue.
Now, as far as the eyes, you mentioned petechiae around the face and the eyes as well as the neck. Did you notice anything else about her eyes?
So the pupils were fixed and enlarged.
Why is that significant to you?
So oftentimes when we see it coming in, it can indicate two different things. Some of the medications like epinephrine can cause the pupils to dilate, but also if the brain is starting to become damaged or not functioning, then you start to lose initially some of the signals that would make the pupils smaller. So they'll tend to start to get enlarged or dilated if there's brain injury starting or has occurred.
Now, you indicated that when Cora arrived, she was not intubated, meaning she did not have a breathing tube in. Did you and your team attempt to intubate her?
Yes.
And did you do that on your own or with the assistance of other parts of the emergency department or the hospital?
So we had anesthesia there. After we got the phone calls of multiple patients coming in, typically we'll have all the help that we could possibly need there to be able to take care of all the patients. So I had an anesthesiologist in the room with me who put the breathing tube in.
In instances where an individual might have suffered some sort of injury to their neck, does that complicate the insertion of a breathing tube?
It can, yeah, because normally you might need to move or tilt the head to get a direct view where you can put a breathing tube in. But when there's a concern for neck injury, we stabilize it typically with a collar or manually. So you don't have the ability to move the head and the neck around to try and get a better view.
Once a breathing tube was put in, were you and your team able to manually give breath to Cora?
Yes.
Now, did you then perform an assessment, a cardiac assessment of her?
Yeah, so in addition to listening to the heart, feeling for a pulse, we'll also tend to use an ultrasound.
Also, court TV, law and crime. We don't want to see this. We don't. We really, really don't. In fact, it's already uncomfortable. Like we already kind of feel like we're watching someone's naked pain, and I don't know about you, but it never feels comfortable. And then for you to zoom in on it, we all feel like, again, accessories in a voyeuristic crime we didn't ask to see. So please kindly focus on the lawyers. Reddington is a font of facial expressions.
Machine in the room where we can kind of get a direct view of heart function.
And you were aware that they had defibrillated her twice in the ambulance. Why is that significant when you're treating a patient that's in cardiac arrest?
So when they defibrillate a patient, it's typically the heart's or might be in a rhythm where it can't pump blood. So it might be sort of out of sync or quivering, where we may attempt to use electricity to kind of shock it back into a rhythm.
Once you performed the ultrasound, the cardiac ultrasound, were there any attempts made further to use a defibrillator or?
Yeah.
Throughout your course of treatment with her, did you continue with various medications?
Yes.
And was CPR ongoing throughout your entire time with her?
Yes.
Were you consulting with any other colleagues or any other hospitals in regards to the care of Cora?
Yeah, so we actually had, in addition to all my colleagues in the emergency room, we had intensive care physicians from Children's that were on the phone with us, kind of working through any things that may have come up in the case, also expecting that they would be receiving the patients from us.
Is your hospital at the Beth Israel equipped to handle this type of pediatric trauma?
So we can do the initial stabilization, but then we need to ship the patients out to either get a specialty care or continued inpatient care.
And how long did efforts in treating Cora continue?
So in the emergency room, roughly 30 minutes.
And fair to say that all of the efforts that you made were not successful?
Correct.
And at approximately 1928 or 7:28, did you finally declare Cora deceased?
Yes.
Thank you. I have nothing further.
Anything?
I have no questions. Thank you, Doctor.
Thank you,
Thanks.
Doc.
Thanks.
We are going to take a puppy kitten break because I anticipate the Commonwealth is going to be bringing up the other physicians that worked on the children next. So we will be taking a little break between each one just to give ourselves just a second to reset. We know all of these factually, we know all of these facts, and this is a tough case. So let's just be kind to ourselves and give ourselves a little break to, honor the little people that aren't here today, that are at the bottom of this case in our own way.
When the world feels like a dumpster dive and humans forget how to thrive, take a break, just you and me, with a puppy and kitten, wild and free. Paws and purrs, let's drift away to a land where tails wag and play. No more noise, just gentle muse in our furry four-legged cruise.
Okay, you guys, let's go on to the next witness, but do be mindful that we are probably going to be dealing with another physician who had to treat one of the children. This is how the Commonwealth has decided to start Monday off. Now, the first witness, that doctor did a phenomenal job of remaining professional, but you could tell how absolutely devastated he was that they couldn't help Cora. So I imagine that this next witness is going to be just as hard to listen to. You guys, be mindful of your mental health. If you need to nope out this morning, nope out. We know the facts at the bottom of this case. We know the tragedy. We don't have to stare at it face on in order to honor it. Be a good person today if you can't, watch the trial. That's a way to help.
All right, good morning, Doctor.
Morning.
If I may.
Yes, please.
Thank you. Good morning. Can you please state and spell your name for the record?
My name's Dr. Andrew Capraro, last name Capraro,
And your date of birth, please?
July 9th, 1970.
What do you do for a living?
I'm an attending physician in the emergency department at Boston Children's Hospital.
Have you had a stroke? And I only ask you because, okay, look, my neurospicy brain noticed that one side of your mouth emotes more than the other. And look, I know I'm not supposed to ask if you had a stroke, but I notice these things. And this is why I don't look people in the face, because I'm often wondering if they have had a stroke or if that mole is malignant. But nice hair.
And how long have you done that?
For the last 26 years.
Can you just briefly describe for us the training and education you had to qualify for that role?
I went to Providence College undergrad and then went to Brown Medical School. Subsequently, I went to Connecticut Children's Medical Center for my pediatric residency, and then did fellowship training in pediatric emergency medicine at Boston Children's Hospital from 2000 to 2003, and have been attending there ever since.
And what's involved with being an attending at Boston Children's Hospital?
It means that I am guiding the care and treatment for the patients that I am seeing during my particular shift.
And are you assigned to a specific location or area of the hospital?
I'm always in the emergency department, and the emergency department is broken up into different zones, of which I am sort of the primary attending for one set of rooms.
I want to direct your attention to January 24th, 2023. Were you working that evening?
I was.
And at some point in time, did you learn that a patient named Clancy was going to be transported to your hospital?
I did.
And do you recall where he was being brought from?
From Beth Israel, Plymouth, I believe.
And was he being med flighted to your facility?
Correct.
And were you provided with some information about the patient in order to prepare for his arrival?
I was.
And what did you learn?
It seems yeah, she wasn't crazy. Wouldn't those doctors be great witnesses? I think they're going on a very linear retelling of this. Um, and strategically, I don't think that was the best way to do that. I think had they even approached us the way Daryl Brooks, the prosecution team, where they did take a very enormous linear case, but they got the important witnesses up, the witnesses that weren't going to drain the soul out of the jury. And they still weren't easy witnesses. These witnesses were still incredibly hard to listen to, but they were able to, control their feelings, answer questions, and deal with the fact that stupid, dumb Daryl Brooks was going to be, cross-examining them. And I think the state did a really good job of minimizing the emotional detachment of the jury and getting them to be focused on the facts, whereas the Commonwealth seems to be incredibly focused on getting you to feel the feelings, and they're giving you facts, but they're not giving you the facts that matter. And I think that the jury is going to start getting irritated that they're not hearing the facts that matter.
We have a communication center where facilities that are transferring patients to us call to let us know that the patient is coming. And so that comm center had been notified about this patient, who then got in touch with me as the attending who would be caring for the patient, to let me know what had happened there and the condition of the patient when he was arriving.
And what did you learn about the condition of the patient, Clancy, as he was being flown to your hospital?
What I was told was that it was believed that the patient had been strangled, and when he arrived at Plymouth, he was in cardiac arrest, that they had intubated him and initiated CPR, and they had gotten return of spontaneous circulation, and that they were then going to transfer him to us for further evaluation and care.
And at some point in time, did Callan arrive at your hospital?
That is correct.
And were you able to observe him physically?
Yes.
What observations did you make about his physical condition?
He was cold on arrival, and he was quite limp, was not making any purposeful movements on his own. His pupils were fixed and dilated, and he had ligature marks about his neck with some swelling of the neck.
And his pupils being fixed and dilated, is that medically significant for you?
Yes, it is.
And why is that?
It typically means that significant injury has happened to the brain, such that there is brain swelling that has sort of it has overwhelmed the capacity of the skull, such that the swelling has made the brain sort of.
And I can only speak for myself, but I have so distanced myself that the passive part of my brain, so basically, let me explain to you how my brain is going to deal with this witness if I'm a juror. If I'm the one juror that you probably want that is going to try my damnedest to only look at the fact pattern and try to keep all of my feelings out of this, you have so emotionally fried me that now I am paying attention to his lateral facial movement that isn't mirrored on the other side. I am noticing that, God, he has a really nice voice. I listen to him play audiobooks, so I am passively listening to the facts. I mean, I would be doing my job, but I would be giving my brain permission to wander. And normally I don't do that. Normally when I'm on a trial, I am writing down as many notes as I can to be a good listener and to kind of be a good repository of fact for you guys. But if I'm a juror in this trial, I have actively cut off that part of my brain to protect myself. And I do think that lawyers sometimes forget that jurors are people. And just because, you as an attorney have gotten to sit for a year, 2 years with some of these terrible, horrific facts, that's not what the jury is going to experience, and the jury cannot vent to anyone. And I really wish that attorneys would take more care for the mental health of the jury. I understand that professionally it's not something we require of them, but strategically it would behoove lawyers from the defense and the state to be mindful of what we are asking the jury to witness and how best to approach it, how best to present that in a way that will allow them to accept and receive this information and still be willing for more. Because I can tell you, it's not good that a week into a difficult trial, I am already allowing my mind to wander. Even the Athena Strand trial that was hard as hell to sit through, I didn't do this. I didn't allow my brain to wander because at least, every witness had a new for the defense had a new level of stupid they were trying to convey. It wasn't the same level of stupid every time. There were, obvious follow-throughs, but I was paying attention. Right now, I am actively, again, listening, but not intaking the way I should be because I am trying to protect myself from emotional pain. And I don't think the Commonwealth has thought their strategy through. Oh, crud.
Herniate through the base of the skull.
Does that mean the brain's swelling so much it's pushing through the skull?
Correct.
And what observations did you make of his heart rate?
His heart was beating, and we did have to provide him with an epinephrine drip to keep his heart rate and his blood pressure within normal limits, but it was beating on its own.
And how did you know that you had to provide the epinephrine for him to stabilize that heart rate?
It was initiated at BI because they had noticed that his blood pressure was low, and you need to have normal blood pressure for the blood to perfuse your organs and keep them healthy. And so we were looking for certain parameters to sort of maintain that, which we did on that epinephrine drip.
And when you say BI, you're referring to Beth Israel?
Yes, I'm sorry about that.
That's okay. And so as far as his breathing, was he breathing on his own?
He had been intubated at the outside hospital, and he was needing a ventilator to breathe for him. Occasionally, he would have sort of a breath on his own, we would notice. We were able to see that because when he attempted to take a breath on his own, he would trigger the ventilator to continue that breath. But it was rare. For sure, he needed the ventilator to maintain his ventilation.
Would it be fair to say that the majority of his breathing was being done by the ventilator?
Yes, the vast majority of his breathing.
Now, once you have received this information while he's coming in, and then you've made your own physical observations of Callan, are there certain tests that you have run on him?
Yeah, our job once we received him was to perform further evaluation and stabilization to help determine what the next steps of his medical care would be. So prior to him arriving, we had contacted our trauma team and our ICU doctors to let them know that he was coming and that we would need their assistance. And then under my care, we performed some routine blood work, so a head CT, a neck CT, and a chest X-ray to sort of help us guide the next steps.
And from the head CT and the other testing that you did, what were you able to learn from the results of those tests?
The head CT in particular showed significant brain swelling consistent with hypoxic ischemic injury, which was which was the most significant finding that we found.
So could you please explain for us what is hypoxic ischemic injury?
Hypoxic is just a fancy word for not getting enough oxygen, and ischemic is just a fancy word for not getting enough blood flow. And so when your organs don't get enough oxygen and blood, they sort of suffer injury and therefore get to...
God bless it. There is nothing that is more kryptonite to me than a stoic person hanging on. And God bless these doctors who I couldn't do it. My bonus daughter, I am so proud of her. Her mom and Mr. Mo did a phenomenal job raising just an incredible human being, and I'm so lucky that I was even invited to be a part of it as a bonus mom. And She is working hard to be a pediatrician in one of the big kid hospitals here, and I don't know how she does it, 'cause I couldn't. And, God bless the doctors that work with kiddos and go in and know that they might not be able to save all of them, but they work their damned best to try to. Again, you have to know, even if you are the most disconnected from emotions anywhere, that these patients that they can't save live with them, and they carry them home, and they carry them with them, and there was such a better way to present this. Now, I do have an email out to, JD, A Lawyer Explains, Tony DeWitt. He has been my go-to, for whenever I feel like I'm getting too emotionally blindsided by this case, to kind of make sure I am not being, incredibly just dismissive of the state's case and, overly, overly getting emotional and missing some of the fact patterns. So I would recommend JD, A Lawyer Explains, but I have reached out to him because I think that he is right that there could have been a different way to present this case, and what would that have looked like? What would justice tinged with mercy and humanity and compassion have looked like? What would the case have been presented? How would he have presented the case? Is more what I wanted to talk to him about, or anything he wants to talk about, but I have reached out. So hopefully he is having a wonderful summer and we can collaborate soon on that, because I would love to hear a lawyer's perspective of where this could have been done better.
Swelling. And so his brain was showing evidence of that.
So would it be fair to say that his brain wasn't getting enough oxygen and blood flow, and then because of that, it was damaged and swelling?
Correct.
Now, this type of swelling and injury, as you're describing it, can that be caused by strangulation, the injury of the brain?
Most certainly.
And you mentioned earlier that you did see some marks around his neck. Is that correct?
Correct.
And what were those consistent with?
Strangulation of some sort, most likely from an object, based upon the linear aspect of the bruising.
And when you say the linear aspect of the bruising, does that mean it's in a straight line?
Correct.
Now, once you had the results of this testing, was there, did you make a decision on what to do next?
Yeah, the main thing was to help us figure out, did the patient need to go to the operating room for some sort of other procedure to help with this, or was this something that could be dealt with medically? And so once we had the results of the head CT and then the neck CT as well, it was felt that the next appropriate step in his medical care would be to be transitioned to the intensive care unit for them to take over care.
Why was it that surgery was not an option to help Kellen in this situation?
Yeah, the neurosurgery doctors were there to sort of help us make that decision. There was no significant bleeding, for example, that would need to be evacuated. There was nothing that they felt from a surgical point of view would help alleviate the problems that we saw in the CT.
Okay. And so was his care transferred to the ICU?
That is correct.
And once Kellen was transferred to the intensive care unit, did your care for him end at that point?
Correct.
I have nothing further. Thank you.
Thank you. Mr. Reddington?
No questions, thank you.
Thank you, Doctor.
And thank you, doctor, for the skills that you try to use for all of your patients. What kills me, again, I'm getting emotional. This case has been very odd for the emotions that it brings out in me. It so pisses me off that good doctors, and you can tell, I've seen a lot of a-hole doctors, and to see two really good doctors have to relive losing their patients, which I am sure guts them on, not only a professional but human level. Thank you. Thank you for going in every day and knowing you're not gonna save every patient, but giving it your all. Because I don't know if I could do it, and you do it for kiddos, and to be an angel in a parent's life, to be able to give them answers, even if they're heartbreaking. I don't know I could do it. So, puppy kitten break, you guys, because apparently we are just going to be a parade of irritated and emotional mows today.
When the world feels like a dumpster dive and humans forget how to thrive, take a break, just you and me, with a puppy and kitten, wild and free. Paws and purrs, let's drift away to a land where tails wag and play. No more noise, just gentle muse in our furry four-legged cruise.
Wait a
Roll
minute.
calls Dr. David Cassavant.
Oh, how did I miss? Oh, is that the same guy or?
And when
Okay,
you
that
say the
is the
linear,
same guy. Sorry, faces. All right. Dr. Kevorkian? I thought you didn't start practice medicine and or weren't alive anymore.
Good morning, do you solemnly swear that the testimony and the evidence you shall give to the court, the attorney, and the not having been the common law and the defendant class shall be the truth, the whole truth, and nothing but the truth, so help you God. Thank you. You may have a seat, sir.
All right, good morning, Doctor.
Good morning. Morning, Hunter.
Attorney Sprague.
thank you. Good morning. Can you please state and spell your name for the record?
Surely. My first name is David. My last name is Cassavant. It's spelled Casavant.
And your date of birth, sir?
5263.
What do you do for a living?
I'm an ICU physician at Boston.
No, this is if Kevin Bacon wasn't a movie star and had years and years of hard living. He stayed in Footloose Town and he never got out. Sorry, look, I know you guys, this might seem inappropriate. These are my coping mechanisms. There are millions of channels on the internet. If anything I say out of my mouth hole offends you, Law and Crime has no commentary.
Children's Hospital.
Can you briefly describe for us your educational and training background?
Sure. I went to college out at Holy Cross in Worcester and then to medical school at Boston University. I did my initial pediatric residency at Mass General Hospital, and then went back and did a fellowship in ICU medicine at that hospital as well.
And where do you currently work?
I currently work at Boston Children's Hospital in the medical surgical ICU.
And how long have you worked at Boston Children's Hospital?
18 years.
And have you always worked in the ICU there?
Yes.
I want to direct your attention to January 26, 2023. At that point in time, did you take over the care of a patient named Clancy?
I did.
And prior to taking over the care of Clancy, did you do anything to familiarize yourself with his treatment and care?
Yes, I did. One of my colleagues had taken care of him the day before in the ICU, and I spoke with her, and so I was familiar with his case.
Okay. And did you also review reports and testing that had been performed while he was at the hospital?
Yes, I did.
Okay. And after reviewing,
It's a simple thing. I don't understand how she can't just lower her register a little bit. Like, this is how I talk when I'm talking about something really exciting. And then this is how I talk when I want to, again, I may not know how to actually express things all the time, but I have learned that a simple change in my tone, a bit more mindfulness from me can make a person feel at least a little bit of humanity, a little bit of comfort. I, the mismatch between her pitch, her tonality, and the subject matter is very jarring to me.
the reports and the test results and speaking to your colleague, can you tell us what you learned from all of that?
It seemed that Callan had a severe neurologic injury based on both testing and the examination that I did at the time.
And when you say a neurologic injury, is that a brain injury?
It's a brain injury. Yes, it is. Yeah.
And did you review specifically a head CT scan?
I don't know what it is about this gentleman in particular, but I am rarely moved to give someone a hug, and it usually ends up as patting, but there is something else going on in this man's life, and he is barely holding it together, and I don't have to be a genius to figure this out, but this man is in survival mode, and it's very It's very easy, I think, for the Commonwealth to forget that there are more than the victims listed on the charging documents. This man, for all rights and intents and purposes, could be considered a victim because, he did everything in his power and he is still going to carry the emotional weight and looks like he's carrying the emotional weight of not only this, but everything else in the entire world on his shoulders. And instead of letting him have this and letting it be private, we are trotting him in here for something the defense does not disagree with. I will never understand the Commonwealth.
Of Callan.
Yes, I did.
And what did the head CT scan show you or tell you about his condition?
Well, the head CT is a picture of the brain, which was done in the emergency room when he was admitted to Boston Children's Hospital, and the CT scan showed an enormous amount of swelling of the brain itself.
And that the swelling of the brain, is that medically significant?
Very much so. When you have an injury to the brain that is caused by anoxia, which means a lack of oxygen, I describe this with families that the injury is very much like being out in the sun. You don't notice it at the time, but swelling occurs over the course of time. And one of the things with a lack of oxygen to the brain is the injury occurs and then swelling starts to happen over the course of time, typically peaking at 48 to 72 hours. When you see swelling that happens that early in a case, as in Callan's, it means that there's been a very significant lack of oxygen and therefore injury to the brain itself.
So, for example, some types of injuries that would withhold oxygen from the brain would be more mild and the swelling would occur over time. Is that correct?
That's exactly correct, yes.
So if a severe injury happens that withholds oxygen from the brain, that's when you see that immediate swelling like Callan had?
Very much so. Sort of the comparison of a sunburn to a burn that you might get on.
Thank God. And I am going to do more asides on this. This is the part that I geek out on. So again, I'm going to stop masking a lot and I'm going to pause when I want to. If that, means that you're not going to watch, thanks for giving me a shot. I love this. Now, whether she knows about it or not, she has unintentionally given him a chance to get into a mode where he feels comfort and control. I love the change in his posture as he's gone into professor mode. You can tell that this is much more comfortable for him. And even though it's unintentional on the Commonwealth's part, I am glad as an observer that he's getting this emotional break where he can get into sort of professor mode, because we all need that. And I'm glad that, he is able to get that because he's not going to get any human sympathy or comfort from the Commonwealth.
From a stove. This was a stove. It's very, very profound.
Did you perform a physical examination of Callan?
I did.
And what did you observe?
Well, one of the first things that I noticed as I approached him was that he had a breathing tube in place, and I knew from my colleague that he was not on any sedation, which is very difficult to tolerate, having a breathing tube through the vocal cords if you're not sedated, and he was not sedated at the time. The next thing is when I approach a patient in their bed in the ICU, we always start with a quick introduction that we're going to be coming near them in case they're asleep. And I usually start with something along the lines of, I'm Dr. Dave. I'm just going to listen to your heart. And
What a wonderful and small, and I am going to talk from a patient's perspective. When you are in a hospital bed and your entire body is out of control, the the small act of, "Hi, I am a doctor, I'm here to help you, but you still have agency over your body. I'm still going to introduce myself to you. I'm going to treat you like a human and not a chart or a tick box or a disease." These are the kind of doctors that we need to protect, and as a patient, the doctors with humanity that give you the respect that you're not just a patient, you're a human being and see you as a human being and not just a chart are rare and absolute diamonds in this world, and we need to protect them. I'm getting irrationally pissed off that, these good doctors are being forced to relive this.
I'd usually address them by name and to see if they start to respond. And then I'll go ahead with the rest of the exam, but that's just to sort of warn them that someone might be touching them. And then I'll listen to heart, lungs, and then to move forward to see if how responsive they are. So if you get no response at all,
Let's see. Neither the state or the defense has said what kind of order this actually happened in, which child went first. Cora was the oldest of the three children chronologically, then Dawson, and then Callum. But as far as whether or not anyone has figured out kind of the chronological whom was attacked first, I don't think anyone has given that. And, Aaron, it is because I was reliably told, not only by the Browd besties themselves, but their bunions and funyuns, that, these eyebrows are the only way to be a real true crime, journalist. Basically, it is effective and passive mockery of two people that I really don't approve covering this case. Um, and sometimes it's the only way that I get to look forward to this trial because I know I am going to be just bringing you guys a parade of human misery. So they are dual purpose, they are passive mockery, and they are also a coping mechanism because I can look up and even if I'm having to relay some of the most heartbreaking stuff, I can at least, get a small internal smile at the stupid eyebrows. And thank you, Wolfram, for your Modly Mod duties. Go have a lovely lunch.
from the initial, just using your voice. The next thing is and then from the exam, if they don't move around, then you start to sort of think, well, let's see how responsive they are. And so the next thing is sort of a gentle touch off into the bottom of the foot to see you stroke the bottom of the foot and you see if they pull away. And then you can move. If you get no response from that, we'll do something that's a little bit more noxious or painful, where you can sort of pinch a little bit of skin to see if they start to react, or pushing on the fingernail and the nail bed pressure, which is actually very noxious. And if you can see several types of response, either no response, or you can see a very
You'll see paramedics doing this a lot to people who are suspected of possibly having an overdose. Sternum, rubbing on the sternum, it is very painful. It's not a sensation that most humans like. And that is something that you'll see first responders use too, to kind of not to be a jerk face, but to try to see if your brain is at all able of being roused by pain.
specific response where they pull away from that area. And that's a specific, or you can see generalized response, which are all sort of graded along those that are as we're sort of getting a sense for what their level of consciousness was.
So if I could go over a few of those things that you just mentioned.
Sorry.
You said that that the first thing that you noticed that was significant was that Callan had the breathing tube in place through the vocal cords
Yes.
without any sedation. So without sedation, would having a breathing tube in that place cause pain?
Yes. No one would be able to tolerate it.
And so Callan was able to tolerate it without any sedation.
Yes.
Would that
Not tolerate it. Ma'am, you don't understand the subtext. And god dang it, why is the only autist on screen having to explain this to you? He was able to tolerate it because he wasn't here anymore. Yes, his little body and his little brain were still technically making signals. But his brain wasn't even able to register pain. Do you not get the heartbreaking just pronouncement that is? I know you don't because your tone hasn't changed, Commonwealth. But what this doctor is trying to tell you without words is that this little boy was probably already gone. That's what he's trying to say without saying it. And you're just like, oh, so he wouldn't tolerate it? It'd be like really super duper uncomfy. Did you take emotional, like empathy classes from Jeff or Jess Fartshadow? I swear to goodness, why must I be the empath in the room?
indicate he wasn't feeling that pain at that time?
Yes, exactly.
And you mentioned that you would address the patient by name and talk to them. Was there any reaction from Callan when you did that?
No, there was not.
And then you mentioned you would rub maybe something along the foot.
But thank you. Thank you for honoring Callum by treating him like a patient and a human that was there. God, this prosecutor pisses me off. I'm taking a break, you guys.
there any reaction?
No, there was not.
And did you do what you described in pinching the fingernail or pinching somewhere on Callan to see if he responded?
Yes.
And did he respond?
No, he did not.
And what did these interactions and tests on Callan tell you about his condition?
This told me that he was unresponsive. He was unresponsive to both things that would cause discomfort and things that would cause pain.
Did you also do anything in terms of looking at his pupils and any tests on his eyes?
Yes. So after the all the other things that we look at the pupils, and so one of the things is we have it's a reflex response. If a light is shown in an eye, the pupil constricts. And what I noted about Callan was that his pupils stayed widely open and did not constrict.
And when someone's pupils stay open and wide when you shine a light in them, what does that indicate medically?
Well, the eyes are a direct extension of the brain, so that's why we focus a lot on them as an area of investigation, and the lack of a.
Yeah, I guess there's that. When I hear him talk, I'm imagining myself in the exam room with him, with little Callum, and him doing all these tests, and at the end of each of these tests, waiting, and just saying, "Come on, little guy, you can do it. Come on, come on." And that's what the attorney doesn't get is behind every one of these tests that, Callum didn't react to was that hope, that prayer that, "Come on, you can do it this time." Just a little show, just something that I can see to say something. And then he goes on to the next test and the next test and the pupils, and every little bit of that is just another confirmation of the reality that you're staring at that you don't want to admit. And you can be the smartest doctor. I mean, this is only my imagination, trying to put myself in his shoes, and maybe he doesn't experience the world like this. But I could imagine if I were a doctor and, I keep seeing these signs and I know what they mean, there would still be a part of me with every patient that would be like, come on, you can do it every time I pinch, or try to get a reaction. There would be a little prayer that would go up and say, "Come on, we can do this. We can get you through this." And that has to be an incredible load that you carry because the signs aren't good and that reality is reality. But there has to be that hope. That's what keeps you going and fighting. And the way she continues to misunderstand what these are, the way she just cannot just, the customer service voice is going to drive me batty today.
Response to light indicates that there's some abnormality to that, and in this case, it was a brain injury. There's medications that can keep your eyes open if you've ever had an eye exam, but that was not the case with Callan.
And just to be clear, when you're talking about brain injury, we're not talking about some type of trauma that was inflicted on the brain. You're talking about the lack of oxygen and blood flow causing an injury to the brain, correct?
That's exactly correct, yes.
At that point in time, did you work with another doctor to do more in-depth testing regarding his neurological status?
Yes. So at Children's, we have multiple teams that come together for a patient, for many patients. But for Callan, the neurology team was there from the beginning. And when in a case like this, when we see no response in an unresponsive patient, we start to get our neurology team. And one of the things we start to do is brain death testing to see if they could be what we call brain dead, meaning that the brain itself is not functioning. And that even though their heart is still beating.
How is it that someone's heart can be beating if their brain is dead?
It's a really good question. So there's actually two parts to the nervous system. The one is the part that we see the most in people when they react, and they react to us and they speak and they do things. The other one is the autonomic or automatic system. And the automatic system is largely in charge of the things like the heart, if the heart has not been injured. And so it was sort of continuing on.
And does that give you any indication, the fact that the heart was still continuing on, about where the injuries were in the brain?
Yes, it does actually. Yeah.
Where would that be?
Yeah. So
We're bringing out the brain. So the brain is a wonderful, unique thing that doctors barely understand. I understand less than them because I'm not a doctorologist. But the cerebellum, this little bitty part of your brain that's on the bottom of this is why right here, this little green bit, that's your mini brain. That's the part that controls the breathing and everything. And unfortunately, when your brain swells, this little part that's keeping all the other parts going, the, things that you're not thinking about, blinking. You are thinking about breathing now that I brought it up, but normally you're not thinking about breathing. And once this swells and gets injured, there's nothing more that they can do. But if you needed visual explanation, it's the little green thing right there. And, this is fun and magnetic to play with while I'm dealing with the Commonwealth. Have your emotional support fidget spinners with you because we're going to need them, you guys.
The large part of the brain that we sort of think of as when we see the pictures of the brain, that's the cerebellum, and that's the biggest thing in humans that is most developed, and that's in charge of our consciousness, our reaction to things, whereas the brain stem, which is another part, and that's really part of the autonomic system, and that's the same in almost all vertebrates and mammals.
I don't think it's green, but if you're going by my brain, it must be green because the model is green, but I don't think it is actually green. I could be wrong.
And it's much more automatic. And so it tells me that it seemed the cerebellum, which is that part that makes us sort of the human side of what we do, that's much more sensitive to a lack of oxygen, to an anoxic injury. And it told me that was really where that injury was in that part of the brain, much less so in the brain stem itself.
So would it be fair to say that the brain stem itself that controls those automatic responses was still functioning somewhat, but the part of the brain that made Callan was not functioning?
That's exactly correct, yeah.
And could you describe for us the brain death testing?
Sure. So the brain death testing at Boston Children's it's a very strict testing that includes some of the things that I just mentioned, but we work with our we have, there's a checklist that we work on with our neurologic colleagues. And we sort of go through each of what we would expect for responses from someone. And we actually then work through different of the nerve sets that we would expect them to respond to. We have it set up so that there's an ICU physician is there, and then a neurologist is there, and the neurologist and the neurology team, they're the ones who perform the brain death testing. And then the test is then repeated again 24 hours later, just to make sure that there's no piece of that is different or incongruous with a diagnosis of brain death.
And while the neurologist is doing this testing, are you there present, watching the testing and seeing the results as it happens?
Absolutely, yeah. So we're sort of committed to being there for the whole time. And the brain death testing itself goes through some really basic things. Again, as I described earlier, the things that would be painful and do they pull away or not. The eyes, looking at the reflexes of the eyes. There's also other reflexes too. Things like if you stroke the cornea, which is the front of the eye, people blink, and that's so the blink reflex, cough, gag. There's also a reflex where they actually put cold water into an ear, and that gives people a disequilibrium. And so those are all the things that we think about. And then also too, there's some breathing components to that as well.
Is one of those breathing components an apnea test?
Yes, it is. Yeah.
And what is an apnea test?
So apnea is a word that just describes describes a lack of breathing.
And how do you test that?
So in a patient such as Callan, what we do, and in any patient when we're doing brain death testing, we actually disconnect them from the ventilator. And the reason that we do that is we want to see if that autonomic system in the brain will start to react as the carbon dioxide starts to increase. So our body makes carbon dioxide all the time, and the way we get rid of it is by exhaling. And where we breathe in fresh oxygen, and then we breathe out CO2. And what we do is we disconnect from the ventilator to see if, knowing that their carbon dioxide will start to rise, and the normal response for that autonomic part of the brain would be to sort of increase breathing. That's why we breathe when we sleep, because as we go to sleep, the conscious part of our brain stops, but the autonomic part kicks in, and then we breathe right through our sleep because that carbon dioxide rises.
So in a patient who has brain death, would it be accurate to state that as the carbon dioxide level increases, the automatic response would be to take a breath to get more oxygen, but a patient who's brain dead won't do that?
That's correct.
And did you do all of these tests, or did the neurologist do all these tests on Callan while you observed?
Yes, they did. Yeah.
And did he have any response to any of the physical tests where you were looking for a reflex or a reaction?
No, he did not. No response to any.
And what was his reaction or results on the apnea test?
So the apnea test, again, we do all the brain testing one day, and then we wait at least 24 hours for the second one. The first, and what we expect with the carbon dioxide is that it will increase. We have it written in our, so it's all in writing for our protocol, that it will increase by 20 or get to a level of 60. A normal CO2 would be around 40. And the first time we did that, on the first day, it actually went to 59.7, not 60. And again, it was in our protocol as it has to get to 60 or increase by 20. And I actually talked to my colleagues, including neurology. I said, I know this is very close. It's 59.7, but it's not 60. I repeated that piece of the test later.
God bless this man. This man was fighting for Callum, and thank you for fighting for him. You know, it's very telling the way he said, you know, I went to my colleague and I was like, it was on the line. This man fights for his patients, and bless him for it.
on that day to make sure that it was valid. And as I say, I checked with everyone to make sure that I was doing the right thing. They all agreed that we should just, and the second time it went to 87. So that was, everything else was the same. And we made sure that there's things that we look at too, to make sure that there's not on any medications, that there's no changes in his temperature, there's no abnormalities of the salts in the blood, what we call the electrolytes. So all those conditions were the exact same. And I repeated that later on in the day, and it did come back positive.
Why is it so important that you meet that specific criteria? Why is 0.3 of a point so important?
Well, I wanted to make sure that there was no question about the data that we were gathering at the time.
And you said that this testing is again repeated 24 hours later, correct?
Yes, it is.
Why is that?
Well, that's just to make sure that if there were any lingering effects of medications, if there was anything that else might have changed in the patient's level of alertness or level of response, to make sure that it still meets all those requirements 24 hours later.
And is it because you want to be sure that there's brain death before you remove life support?
Yes, and again, it's too important. It's too important a discussion and a gathering of data to not be very exact about it.
And so when you did observe the testing and then the following day on Callan, were the results the same in terms of no reaction and the carbon dioxide increase?
Could she possibly turn down the perky in her voice 130%? I don't know if she's not seeing him. I would love to. I'm going to be looking through X this evening to see if there's anyone who I trust who's in the courtroom, and there are good presenters. I do want to say that as much as I am prone to smiting of those whose shenanigans I find inappropriate and intolerable. Defense Diaries has been covering this. Emily C, I think, is doing some coverage on this. There are a lot of good content creators, and I'm hoping that someone can give us an impression of how the jury is handling this. Now, obviously, don't give out personal information of the jury, but how they're handling this, because I don't know if the Commonwealth has, and maybe I put too much emphasis on how the jury handles things since I come at cases as a potential juror, but I can't imagine that this is easy for them to watch.
Saying.
Yes, they were.
And at that point in time, did he meet brain death criteria?
He did. He met.
All she had to do, again, that sentence in and of itself isn't bad. It's a question that would probably be asked, but if she had just, at the end of those 24 hours, pause. Did Callum, small pause, meet the requirements? Just a couple little pauses and taking your tone down just a register, just a little, just an octave. And the sad thing is that I could script this out for her. And she wouldn't have to actually feel any of these feelings, but there has to be a consideration to delivery and the incongruity of her happy, cheerful voice and this man shutting down on stand. I wouldn't be able to intake much, is all I've got to say. This would be so glaringly off to me that I would be intaking what he's saying, but am I listening to what the prosecutor is asking him? No, I'm listening to him because he is utterly more fascinating than anything the prosecutor has brought up. This man is a man I would like to meet outside of the court and just listen to his stories. That is why I'm paying attention. And I think the Commonwealth is going to run into this with the jury. Now, I tend to feel in stereo sound. I tend to not only feel, I tend to put myself in everyone's feelings. And if you have a juror like me, this is not a good place to be on a Monday of the second week of your trial, is all I've got to say. Oh, crud. I keep doing that.
So we had determined that it was that he had met death by neurologic criteria.
And at that point in time, was a decision made to stop life support?
Yes, it was.
And that's done in consultation with the family, his father, correct?
Yes, that's true.
Okay. And was life support ended for Callan Clancy on January 27th, 2023?
It was, and
And again, just the way you could answer that question or ask that question, was Callum allowed to rest? Or you don't have to be euphemistic. Was that done the very next day? You don't have to it's just the happiness in her voice. Ugh. Samantha Shoelover, as sexist as it sounds, Perky Penny isn't always the best person to question a witness. A somber man tone would be the best to get points across and less distracting than her polar opposite tone. Yeah, and I get where women have been conditioned to not sound too bossy, to sound agreeable. And so I'm not judging her on what, she is projecting thinking society wants it. But there has to be that level of self-reflection and reading the room that says, "You know what? Maybe perky customer service, maybe I'm allowed to, in my professional capacity as a prosecutor, allow some humanity to sink into my tone. I don't have to be unprofessional, I don't have to curse, but I can allow some compassion into my tone once in a while." Haley Mouse, do you notice the witness's reaction to her? He smiles, suggests she's smiling as she's asking the question. Yeah, it it just to me, it's very distracting, and it might not be distracting to everyone. So I am trying to learn that things that I find monumentally distracting about, certain small things or aspects of communication might not be the way everyone else is interpreting things.
One of the things is there's
And this is where the Commonwealth needs to be careful because I am actively fighting my perception that there is some glee being taken in taking Lindsay down a peg or two. They're constantly talking about how she's, losing weight or wanting to exercise. It's just it all reads to me like and again, I could be very wrong at this or about this, but it seems like the popular girl that seemed to have it all together is at her lowest point, and we're gonna kick her because maybe not Lindsay herself, but people who looked like Lindsay, people who had the lifestyle that Lindsay had, from the outside, the very surface view of a happy, easy life. Well, they made fun of me in middle school, so I'm gonna crucify the hell out of Lindsay. That's how it's reading to me. And again, I don't always have the best comprehension of social things, but it's reading to me like I knew some really mean girls in high school who looked like Lindsay, and they made me feel bad about myself, and now's my chance to kick not only Lindsay, but the avatar of every Lindsay in my life who has made me feel less, of a woman or less special or less confident. I'm going to kick her while she's down, and I am going to explain how vapid, shallow, ridiculous, and stupid I thought her life was. While I'm kicking her. I So, for what it's worth, that's what it's reading to me, and I don't particularly like that. I think every single one of us has had middle school bullies, but the magical thing about being an adult is realizing that, you know what? Those popular kids, they didn't have it figured out, and they felt just as alone, just as scared that everyone was gonna figure out that they had no idea what the hell life was. So all of this could have been avoided if you had exercised. Again, you can think Lindsay is a monster, but you can show the situation, you can show the responding witnesses and the doctors a modicum of humanity. You, the law and justice is not going to be rendered ineffective if you show humanity and sympathy for Lindsay. You can have sympathy for Lindsay and still think what she did was so incredibly wrong. But how much of what that was Lindsay and how much of that was everything else? And we could be discussing that very important topic right now, but instead we are we are parading emotional pain on the witness stand for reasons I can only gather the faintest fairy fuck about. So make it make sense, Commonwealth.
When you determine that someone has met criteria for neurologic brain death, that although we know that their brain is not functioning at that point, there's often a period of time where we don't have to his heart is still beating, so we don't have to remove the endotracheal tube at that time. And we often will give families, once it's been confirmed that the brain is no longer functioning, we often give families a period of time to able to process it and a window of time. Sometimes there's relatives who will need to travel and things like that. And so we'll often then choose a time later on to accommodate the rest of life, knowing that they're stable at the time to when we would actually remove the tube, and that would be the declaration of death.
And was that?
And thank God, or the universe, or the spaghetti monster, whomever you believe in, that this doctor with this humanity and this compassion was the one that the Clancys had that got to deal with. Thank God that a man with this much heart was the one that was there during one of their darkest hours, and not someone like the Commonwealth. And you can tell it cost him, but isn't it supposed to cost? Isn't it being human? Isn't rendering compassion in someone's darkest hour, being that hand of humanity, isn't it supposed to cost us just a little bit? Isn't that what being human is about? Is reaching into your own personal, emotions or compassion bank and giving it to someone else? I don't know.
Then in this case, family was given an opportunity to see him, and then life support was ended, and then his heart stopped.
Yes, that's
And
exactly.
he was declared deceased.
Yes.
Thank you.
Attorney Reddington? Thank you, sir. Thank you, Doctor.
Thank you so much.
In lieu of a puppy kitten break, I am sentencing the Commonwealth since they lack humanity. I think they are uniquely qualified to deal with this particular client and thorn in the legal world.
Oh, Sarah, she won't forget. She's an honor roll and no regret. No tears have touched her lashes yet. She's scribbling like a Shakespeare vet. A lawyer came to plead her case, but fled that cell with lightning pace. They skimmed her notes, then left no trace, just vanished from that boon-shaped space. Oh, boon, boon, scribble away 100 pages every day. Your lawyers run, but that's okay. You got cheese and things to say.
All right. Again, with the ruffles, I do not understand them. I do not get them. I will not be a party to the ruffle fashion takeover that is female fashion. I will continue to wear my Tommy Want wingy shirt with pride and without ruffles.
Hey, good morning.
Good morning. May I inquire? Thank you.
Yes, please.
Good morning. Could you please tell the jurors your first and last name?
Kelly McDonough,
Can you spell your last name for the record?
McDonough.
And what do you do for a living?
I'm an emergency medicine physician.
And how long have you been a physician?
11 years.
Can you tell us a little bit about your educational background?
I went to medical school at the University of New England in Maine. I did my residency at Kent Hospital in Rhode Island. I subsequently worked at Kearney Hospital in Dorchester, and I've been at South Shore Hospital since 2021.
And in what, are you primarily in the emergency department at South Shore Hospital?
Correct.
Have you been in any other department at South Shore Hospital?
No.
Are you licensed to practice in Massachusetts?
Yes.
I'm going to draw your attention to January 24th of 2023. Were you working in the emergency department that evening?
I was.
At some point, were you advised that a patient was...
Again, look at that micro. So this is welcome to my world, the world of Mo. There is this
department that evening?
I was.
That micro, that slow blink, that is her setting herself up for these coming questions. She was relaxed when she was talking about her education. And I guess I was so worried all my life that I was the only one putting on a mask that I've become very adept at noticing when other people are putting on their masks or they're detaching for their own emotional safety. Because I'm always like, okay, they do it too. You are sort of, you are less Abby normal than you thought.
At some point, were you advised that a patient was being brought into your emergency department?
I was.
And were you aware of that patient being Lindsay Clancy with a date of birth of 8/11/90?
Yes.
And what kind of information were you given upon learning that the patient was coming here? What were you expecting to receive?
I was expecting a trauma 1 response, a patient who had fallen out of a window from a height and didn't know much more than that.
Okay, and so when you say trauma 1, what does that mean for you?
So we have 2 designations for trauma responses, a trauma 1 and a trauma 2, and there's certain criteria for each. And there's a long list of criteria that are determined by the resource nurse who receives the EMS call.
Okay, and so when we say 1 and 2, which is more serious than the other?
Trauma 1.
Okay. And so what do you do to prepare when a patient is coming in and coming in that it's...
Also, the smartass in me, because the Commonwealth is dragging me through this emotional hellhole, would say, wait a minute, how can she be a trauma 1? I thought she faked her self-deletion. Like, again, Commonwealth, I don't know if you have a person like me on the jury, but I want you to understand that if I am on the jury, by now, you have done pissed me off with the way you have shaded and misrepresented facts that you call evidence, or evidence that you call facts that were just shaded incorrectly and out of context, that I am writing down. My notes are full of, oh, I thought she was faking it. Like, basically, that would be my note. I thought she was faking it. Why was it a trauma 1? And you do not want to be in any side of an argument where I am writing, ad hominem logic attacks on your argument instead of paying attention to whatever it is you want me to be paying attention to.
It's likely a trauma 1 situation.
So we gather in the trauma room and make sure that we have all available staff needed to take care of the patient.
And what kind of staff are with you in the room, in the trauma room?
So for a trauma 1 response, it would be the emergency medicine physician, it would be anesthesia, the trauma surgeons, sometimes neurosurgery will be there.
And fair to say you also have a whole host of other staff, including nurses, emergency room techs, all of those people are also available to assist if you need it.
Correct.
Now, when this individual came in, when Lindsay Clancy came into the emergency department, were you aware from EMS that she had already come in with some sort of neurological deficits?
I think that From my best recollection, we knew that she was unresponsive, found down outside of her home.
Were you advised that it appeared she might have a spinal injury
Yes,
and that she was not she may have been moving her arms and her head, but not her legs?
correct.
Now, when the team was assessing her in the emergency department, what types of steps do you take to perform that assessment of the patient?
So there's a series of steps that we go through to assess a trauma patient that are followed every single time. ABCs, airway, breathing, circulation, and then we do a secondary survey.
Okay. And in this circumstance, was the patient breathing?
Yes,
And when she came into the emergency department, was she breathing on her own or intubated?
she's breathing on her own.
At some point, did the ER staff have to intubate her?
Yes.
And why was that?
For airway protection, there was a concern that maybe she would have a head injury and she would decompensate later. And so to protect her airway, she was intubated.
Now, is that a standard protocol when there's concern for head injury?
Yes.
Did you see any obvious signs of a head injury when she arrived into the emergency department?
No.
What kinds of things would you see if somebody had an obvious head injury?
You might see bleeding or lacerations or abrasions.
Now, did you observe any other obvious injuries to this patient?
I did. She had some superficial lacerations of her neck and wrists bilaterally.
Now, again, just for those of you who are new, old people, sorry about repeating this old, nugget of wisdom. Superficial in medical terminology just means through the upper layer of the dermis or skin, and usually not requiring any medical intervention to heal. So it's, it can look gnarly, but it probably doesn't need stitches. So that is what superficial means, not the colloquial like it was a paper cut. And this is not the first time that the Commonwealth in Massachusetts has done this. Famously, look back at my rant when Hank Brennan tries to use superficial on John's arms when describing the wounds. And the doctor valiantly tries to explain that superficial means something different to doctors.
Do you recall if she came in on a backboard with a C-collar?
She did.
And do you remove the C-collar at some point to assess the patient for injuries?
We didn't completely remove it temporarily to visualize and feel her neck and then put it right back on.
Okay, and you said you did observe some injuries to her neck, correct?
Yes.
So I'm just going to show you some photos that have been already marked, if that's okay, on the screen next to you.
They might be showing photos of Lindsay's neck. I have been
This has
shocked
been
at
marked as exhibit number 1.
at some of the injury video or photos that we've been able to see. Now, they've never been of the children, obviously, but of Lindsay. And I am much more of a CSI, let's learn about things intellectually than see bloody pictures, mostly because I can't tolerate them.
111, is that an accurate representation of the neck injuries you observed?
Yes.
You also indicated that she had some other injuries to her wrists.
Yes.
And I'm just going to show you 112. Is that accurate as to the injuries to the wrist you observed?
Yes.
Now, you described the injuries to as superficial. The injury that's kind of in the middle of the photograph there, can you describe what part of the body that injury is?
You're describing the one that's sort of open?
Yes.
Yeah, so that's the anterior aspect of her wrist.
And were you able to examine that injury?
Not in detail.
Okay. Was it something in your emergency, your assessment of the trauma 1 situation, was that something acute that you had to address?
No.
And is it fair to say that
There's also something particularly uncaring and unfeeling about, and I do think that the Commonwealth needs to be very careful, because all you need is one juror who knows someone who had an attempt, and to call that attempt fakery, it's a cry for help. Yes, whatever label you want to put on it, but if you have if the jurors have anyone in their lives who maybe has dealt with cutting or things like that, it's not superficial when someone you love is going through it. And I think that refusal to give any credence to that is going to be a a pitfall. I understand the Commonwealth doesn't like Lindsay. I'm not asking them to like her. What I am asking them is to show a modicum of humanity and sympathy, if not to Lindsay herself, then to the situation, because I think we can all agree that a happy, contented, well-adjusted person does not have those injuries. Now, we can argue about a whole hell of a lot of other things, but the dismissal of that I find repugnant. And it's just that dismissal. It's these little small missteps that make them almost unwatchable, because they're small, but they're cumulative, and it just shows a utter lack of sympathy for anyone struggling, and I don't think the Commonwealth understands that that's how it's coming off.
That injury goes through kind of the subcutaneous tissue of the skin.
Yes,
Did you observe any injuries to an artery or a vein or anything in that area?
I did not.
And then just showing you Exhibit 113, which is the other wrist. Same thing. Did you observe anything in your assessment, your trauma 1 assessments, to say whether these were acute at the time?
I assume that they're acute.
Okay, but as far as treatment of them, did they require you to immediately address it
No.
to manage blood flow?
Mm-mm. No.
What was the more serious, or what was the focus of your assessment of her in the emergency department?
I think the main concern was for a head injury and or a spinal cord injury.
And you said that as part of the assessment team, you had a neurosurgeon available as well as a trauma surgeon, correct?
There was no neurosurgeon there that day.
Okay. Was there a trauma surgeon?
There was.
Who was that?
Dr. Christina Carpio.
Did you order any series of tests in order to help you assess the nature of whether there was any head injury or what the extent of the spinal injury could have been?
Yes.
What kinds of tests did you order?
CAT scans.
As part of the emergency room protocol, do you also draw blood for patients that come in?
Yes.
And how is that usually done?
It's usually done on arrival by the nursing staff.
And do they draw blood according to a physician's orders, or do they draw blood for various purposes? Explain to us how that works.
Mm-hmm. So it's usually like what we call a rainbow. So they just draw all the tubes of blood as soon as the patient arrives in anticipation for orders.
Okay. And so what happens to the blood after somebody in the emergency department takes it from the patient? Where does it go?
It gets tubed to the lab.
And fair to say that at South Shore Hospital, they have a pneumatic tube system, correct?
Correct.
And that it goes to a separate laboratory.
Correct.
And once a physician then assesses a patient and determines what kinds of testing needs to be done on those samples, how do you communicate?
I think it's the tonal quality. I honestly don't know, because it's always been something that I thought uniquely bothered me. So I've gone out of my way to kind of tune it out, but it's so incongruous to what we're talking about that it just completely misses the point. Almost like Jess Machado, like when she was talking about how Lindsay looked pale and everyone was like, no doy, she's been in prison, her children are no longer on this earth. I don't think she's been worried about tanning. It's just like they see the picture and miss the point entirely. And it's very odd. And it almost leads to you questioning your own perception, or at least me. I'm like, am I reading this wrong?
That to the laboratory.
So orders are put into a computer and they go through the computer to the lab.
And as you're treating a patient, is it oftentimes necessary to change the orders or order additional tests?
Yes.
And so in this particular case, blood and urine was collected from Lindsay Clancy upon her arrival, correct?
Correct.
And then sent to the lab.
Yes.
Now, going back to the image.
Now, it will be interesting to see what toxicology does show up, because Lindsay Clancy, in addition to causing the wounds on her neck and wrists, took a cocktail of multiple medications altogether to, again, enhance effectiveness, and then jumped out the window. So it will be interesting to see if any of those medications that she ingested very close to the incident will show up in toxicology, or whether it's going to be one of those things where there's have to be a lot of calculation to try to figure out if there was any possibility that there could be that could have also been fatal, I guess.
Tests. You said that there were some CT scans that were ordered.
Correct.
What areas of the body were the CT scans for?
It was her entire body, her head, her neck, her chest, her abdomen, and her pelvis.
Now, as far as the CTs for her head, were there more than one CT test for the head?
I don't remember. I'd have to look at my record.
Well, what are the normal, or what are the options for CT head scans?
It's usually just a CT head plane, but you could also do a CT angiogram, depending on your concern for injury.
And do you recall which one you ordered here?
For a trauma one, it would be a plain CT head.
And why do you order that particular test?
Well, we're trying to assess for skull fractures, intracranial bleeding, things like that.
And when you say a plain CT, what's the exact order that's put in for that type of a CT?
CT head.
Okay, and are there CT heads with contrast?
There are.
And are there CT head scans without contrast?
Yes.
And approach the witness.
Me.
Just gonna show you some documents, if that's okay.
Sure.
I apologize, there's a little series of paginations, so I'm just gonna draw your attention to this page that's black, if you could just take a look at it.
Sure. Mm-hmm.
Okay, and I'm just gonna flip to the next page as well.
Cyber Chick Boston, someone took your advice about the blue glasses. I swear my next pair are going to be bright cobalt blue, because there is look, I don't care what Jespart Shadow says, but there is no way you can't feel like an absolute badass if you're wearing a pair of cobalt blue glasses. You just feel like a badass.
The next page is blank, but is this the extent of what you would have received as far as information regarding a head CT that was done?
Yes, I will be going for another 20 minutes, and then we will cut this off, and hopefully I will be back in time that we can finish up in an afternoon session. But I always hesitate to schedule a session after an appointment, just because chaos is abundant in my family. And if shenanigans are to happen, they will happen when I have a second stream scheduled. It is just a fact of life. So I have learned not to schedule second streams.
Without contrast.
Yes.
And I'm going to just draw your attention again to another flagged page here towards the end. It's actually 2 pages from the end of the document, if you could take a look at that.
Mm-hmm.
And does that reflect the report you would have received for the head CT ordered with contrast?
Yes.
And in addition to getting a report from imaging, you also receive some actual images, correct?
Yes.
And do you review those?
Yes.
In this particular circumstance, when it came to the patient of Lindsay Clancy, was there anything remarkable in either of those head CTs?
Not that I recall.
And in fact, the head CT with contrast indicated the impression was unremarkable. CTAF had no evidence intracranial aneurysm, arteriovenous malformation, or abrupt occlusion, correct?
Correct.
What does that mean?
It essentially means it's a normal study.
Yes, if they say nothing of note was noticed and then they go on to list things that were not seen, it means it was clear. But they do have to, for, cover their ass purposes, say that we did specifically look for these, and these, common issues, and we didn't see them. Yeah, I may have gotten in trouble a lot in school for asking stupid questions to which simple looking at the document would answer it.
Now, as far as the other CT scans that were conducted, there were findings, remarkable findings on some of the others, correct?
Correct.
And what did they reflect in your experience as far as her injury goes?
From what I can recall, I know she had a thoracic spine injury.
And how about the CT that was done of the chest area?
I don't recall.
If I may approach.
I love to see her warrior face come out, and then you see her put on her peopling face. It's very interesting to me.
Does that refresh your memory?
Yes.
And what was the extent of the result from the chest CT?
So it talks about her thoracic spine injuries.
Okay. Now, after reviewing all of the images, all of the CT scans that were done here, the cervical spine, the head CTs, the thoracic spine, what was the plan for this particular patient? Was she able to be treated further at South Shore Hospital?
The decision was made by the team that her injuries were too severe to stay at South Shore Hospital, and the decision was made to transfer her to a tertiary care center.
Were you able to stabilize her before transporting?
Yes.
Is that something that's important to make sure a patient is stable before sending them off in the ambulance or a helicopter?
Yes.
And so as far as this particular patient goes, are you aware of whether any surgical intervention had to be done before she was stabilized and transported?
I was not aware of any intervention being done.
And again, you had Dr. Carpio, who was also there to assess that.
Correct. We work as a team.
Kind of going back to those injuries on her neck and her wrist very briefly. Can you explain to us the difference between bleeding in maybe an artery or a vein and how that might present itself in an emergency situation?
Venous bleed would be a little bit slower, darker blood, and arterial bleed would be pulsatile and bright red.
And is it fair to say that when you strike either an artery or a vein that they're of different pressure systems, and so the manner in which the blood comes out is different?
Yes.
In either circumstance where an artery or a vein is struck or nicked or cut, would that be something that you'd have to stabilize for a patient in order to make sure that they don't bleed out?
Yes.
Was that done here?
It wasn't necessary.
Now, this particular patient at some point was noted to be, I think it was referred to as hypothermic.
Mm-hmm.
Do you recall that?
Yes.
Do you recall at what point in your treatment of her was that noted? Was it as she was coming into the emergency department, or did that develop while she was in the emergency department?
I don't recall.
What was the course of treatment for a low body temperature?
We placed something called a bear hugger on them, which is a warming blanket.
And again, medicine can be so multifactorial. The fact that her wounds to her extremities and to her neck wasn't bleeding as much, wasn't actively weeping blood. She had incredible trauma to her torso, which puts the body in shock, meaning all your blood pulls to your center, your vital organs, and keeping your brain alive. But she was also experiencing mild to moderate hypothermia, which is again going to have the same effect of drawing blood to the center and preserving that blood in the areas that are most vital for life. You can lose fingers, you can lose toes, you can lose an arm, you can lose a leg. But if you lose, your internal organs, you're kind of screwed. So it and if the jury is above room temperature IQ, they are going to realize that the big deal that the Commonwealth is making of these wounds not actively, spurting blood is so pointless. It is so pointless in the grand scheme of things that they are going to actively wonder, why in the hell did you focus my attention over here when you have all this other comprehensive evidence that this was not a a farce. The continued argument that this was a false attempt is going to become more and more laughable as we go into Lindsay's actual injuries. And you don't have to like Lindsay to acknowledge the reality that her injuries are catastrophic. Again, I do not understand the unwillingness to admit that these are catastrophic injuries by focusing on the smallest injuries that you can find. It doesn't make logical sense to me. It's not going to win you any points with me or anyone who has a functional frontal cortex. So I don't know why we continue to do it.
And can you explain to us what could cause a person's body temperature to drop to, I think it was 82.1?
There are many reasons, but it could be a metabolic disarray or exposure.
In this circumstance, did you know what the source of the drop in the body temperature was for Ms. Clancy?
No.
And do you recall how long she was in the emergency department before she was transported approximately to the Brigham?
I think it was about 4 hours.
At this time, Your Honor, I would move to enter into evidence a copy of the South Shore Hospital medical records for Lindsay Clancy from January 24th, 23 as the next exhibit.
Is that by agreement? All right. That may be admitted. Or they may be admitted.
And I would also move to enter as the next exhibit a certified copy of imaging records from the South Shore Hospital for Lindsay Clancy from January 24th, 2023.
All right. It may be admitted.
So finally, Dr. McDonough, did this defendant receive surgery at South Shore Hospital?
Not that I'm aware.
Did you observe any cuts, abrasions, or blood on the area of her head?
No.
And based on your review of those findings on the CT scans, was there any noted injury from the head CTs that you could tell?
No.
And were you able, after using that bear hugger device, able to get her her core body temperature back up to normal?
I don't recall.
Did you ever observe those wounds that you observed on her neck or her wrists ever start bleeding actively again?
No.
I have nothing further.
Mr. Reddington.
Morning.
Morning.
So would you agree with me that when Lindsay was brought into the South Shore Hospital that she was unconscious?
Mr. Reddington, I need you. Just 50 shades of logic. Please bring something, anything. My brain is calling out for you. Like, Bonnie Hart is in the background. We need a hero. I don't think that's her name, though. Bonnie Tyler. Bonnie Tyler, not Bonnie Hart. But Bonnie Tyler is singing We Need a Hero. Reddington, please. We need logic. Search your feelings. You will find it so.
I recall her eyes being open, but she was nonverbal.
Okay. So as an experienced emergency room doctor, can you tell me when someone's unconscious, what is that? What are the symptomology of it? What does that mean?
Usually means they're completely unresponsive with eyes closed.
Okay. Was she responsive?
Not verbally.
Was she responsive at all?
She was responsive to pain.
So that means that you would do something to cause pain, perhaps the bottom of the foot or whatever it is, to see if they have a reaction.
Correct.
And would you agree with me that when people even have very, very serious brain injuries, that they can respond to pain stimuli?
Sometimes.
Sometimes. So her eyes were open. Were her
Samantha Shoelover, I think this has been an interesting case for me because I honestly didn't know if I was going to be able to have any compassion for Lindsay. Going in, I think, even just not wanting to look at this case because I didn't think I could have any compassion for Lindsay. But then digging into the facts, after a couple of you guys reached out and asked if I would cover this, I thought, well, I at least need to give it a shot. And the more I started reading about what her health care looked like, all of the medication she was on, I found myself at least being able to have human compassion. Do I know what justice looks like in this case? Absolutely not. And I'm going to do this now because if I don't, I will walk into my youngest, most feral's doctor's appointment with a new doctor, mind you, a brand new pediatrician with fake eyebrows on my forehead. So while I am actually actively thinking about this, we'll take those off. But what has shocked me is, I guess, the compassion I was able to find when I didn't think I would have anything for Lindsay, and actually, if anything, kind of the avatar of what I thought I was going to be being shown up in the Commonwealth, and being a little horrified, honestly, that I was before I looked into all of the facts in this case, I could have easily been just as caustic, just as devoid of mercy and empathy and sympathy as the Commonwealth is behaving. So this has been more of a shocking and hard case for me, because the Commonwealth is being such a butt monkey, and I had gone into this case thinking I would be very much on their side and realizing that, yay, I do have a heart, but also being so incredibly let down that the Commonwealth is not tinging whatever justice looks like. I don't know if justice looks like her being in a mental hospital or in prison or just allowing her to be in the prison of her own mind and body. I don't know. And I'm so glad I'm not on the jury because I don't know what justice looks like. You know, is it enough of a punishment that she lives with the knowledge of this every day of her life? Do we just let her live in this pain and not give her the tools to fix it? Or do we step outside of our rage and offer compassion to someone that when we look at all the facts objectively was struggling and ignored or unseen or missed? And what does that look like? The part the most heartbreaking part of this case to me is that we could be tackling those really big questions that in a rational, compassionate, and sometimes, yes, justifiably angry. There can be justifiable anger in this case. There were so many warning signs missed by people that their sole job is to notice these daggone warning signs. And how were they missed? And how were these calls, not noticed? How have we trained an entire, many generations of girls to mask, when things are wrong? How have we created an entire medical establishment that has never been catered toward women. Most medical studies are on, middle-aged white men, and it's not because I dislike middle-aged white men. They need healthcare too. But we women need healthcare that honor and respects our different bodies. Minorities, people that aren't middle-aged white men need studies that are dedicated to the unique composition and chemical makeup that you know, is part of being, not a middle-aged white guy. Why is it that me as an outsider, a twice college dropout, can have all these observations and the people in power and the people that have the power to change some of these don't ever bring them up? That's the heartbreaking part of this case. We're 20 years on from Andrea Yates, and yet I feel like we haven't moved forward at all in medicine, in mental health. We talk a good game, we shout about it loudly, but we still don't do enough and we still don't understand it. And we still have the stupid view by many people that, depression has to look a certain way and be a constant and, be expressed a certain way to be valid. I didn't think we'd be here at 2026. That's the heartbreaking part for me, because the situation we can all agree is heartbreaking. The fact that instead of finding answers, instead of letting our anger and our rage or whatever we're feeling right at this moment lead to something productive that will make sure that we don't have another Lindsay Clancy. The fact that that isn't being done, but we're sitting through this ridiculous parade of emotional torture, that's the heartbreaking part about it to me. I don't know. Like I said, I don't always have a good gauge in my emotions, but that's the part that breaks my heart. That's the part that makes these trials hard, is that as a society, we could be having the uncomfortable conversations to help fix this, or we could put people in jail. And we're going to have another trial like this, and nothing's going to change.
Are pupils equal and reactive to light?
I don't recall.
You don't recall. What does it mean with PERL, pupils equal reactive to light? What does that mean?
Exactly what you just said. It means her pupils are equal and reactive to light.
And as a doctor, what does that tell you?
It tells me that there's no significant neurologic injury.
And in this case, you don't recall if her pupils were equal or reactive to light?
I don't.
Okay. And that's when you take the little...
And that wouldn't be something she probably sees so many patients every day and does her best to be present with each and every one of them. But equal and reactive to light pupils, that's something that you do quickly, and you only really note it in the scheme of things. Like, so take me as a physical therapy assistant in an aquatic pool. Yes, I'm very much paying attention to respirations and things like that, but I'm not going to make a significant note beyond the number unless it's something concerning. So in a checklist, medical kind of environment, she's just going to say, pupils equal and reactive, and whoever's doing the documentation is going to catch that. But she's not gonna elaborate on that. I.e., the brain seems to be working well. It's called shorthand for a reason. It's shorthand.
Flashlight sometimes, and you put it over the eye and see if there's constriction of the pupil.
Correct.
Did you do additional evaluations of her to see what her neurological function was?
She was pretty quickly intubated from what I recall. So after that, it would be difficult to assess her neurologically.
Sure. Was she on any pain medication, if you remember?
I don't remember.
You recall, did she have difficulty being intubated? I mean, would you agree with me that if you're not under some type of medication or sedation or unconscious, it hurts to be intubated, doesn't it?
We wouldn't intubate somebody without first giving them some induction medicines.
Okay. So what would the induction medicines be?
They're not universal.
Well,
that would depend on the
case. What are the
case.
induction medicines that you used on Lindsay Clancy?
I don't know. I'd have to refer to my record. And also, I wasn't the one who did the intubation.
So she was intubated, had the tube coming out of her mouth. She's laying on the table, and you are continuing an assessment. You were the lead doctor in the emergency room for Lindsay Clancy, right?
I wouldn't say I was the lead. I think the trauma surgeon and I worked together.
Right. Her temperature, her core body temperature was 82 degrees. Is that right?
If that's what the record states, then yes.
I'm sorry?
If that's what her medical record states, then
Well,
yes.
as you sit here, you don't know what her core body temperature was?
I saw her 3 years ago. I see about
Okay, I will ding the defense attorney here a little bit. I understand why he's irritated. I really do. And as much as I want him to be the avatar of our human like irritation with the Commonwealth, he's irritated with the Commonwealth. Don't take it out on this doctor. This doctor, if she were so consumed by remembering every detail of every past patient, she wouldn't be an effective doctor. So while I understand where his indignation is coming from, I do think it's a bit of a misstep for him to be aggressive with her. And and I say that as a human who understands that where it's coming from, and I wanna be right there with him, being a sassy butthole, but it's coming out against the doctor, and I think that's a misstep, and I'm gonna call missteps on both sides.
200 patients a
I'm
month.
sure you're very busy, but this is a murder trial, doctor. Did you review your records and your notes?
I'm happy to look at my record if you bring it
Did
here.
you review your records and notes before you came in here today to testify on this case?
Sir, I did, but I don't have a photographic memory.
Did she regain consciousness at all while she was in your emergency room?
No.
Can you tell me what CSF is?
Cerebrospinal fluid?
Yeah.
Sorry, also, I might like, when questions are asked and I know the answer, I might pop off with them. It's just something I've always, it's just something I've always done, but yeah, I know a right answer.
So what that is?
But it could
CSF?
be. I'm not sure in what context you're referring to it.
Well, how about if there's a massive leakage of CSF from her nose? What does that tell you as a doctor?
It could mean that there's a skull fracture.
Did you notice any clear fluid coming from her nose?
I did not.
Is that something you would look for?
Yes.
How quickly do you get the results of the x-rays when you're in the emergency room?
Well, these were CT scans, but fairly quickly in a trauma.
I'm sorry, CT scans, x-rays. So you had,
Okay, that would have been a perfect time because he has come off as a jerk. And what I would recommend, because look, sometimes I can be fired up and tend to aim it at the wrong person. Now, if I am aware of that, what he could have done right here is just CT, X-ray. Y'all have a lot of stuff to remember. Again, giving that little olive branch, it doesn't erase the fact that he was a jerk, but I think just that little bit of olive branch, that little bit of a respect of her position would have been so well placed there to kind of soften him, eh, because he is kind of looking not so great here.
CT scans that were able to show you the damage to her neck and upper chest. Is that right?
Yes.
And what did those CT scans show you?
Well, what I remember is a thoracic spine injury.
And when you say a thoracic spine injury, would you agree that top part of your neck, your throat area would be cervical, right?
Correct.
And that's when the numbers go C1, 2, or whatever they are. That would be the actual vertebrae in the cervical area of the upper body, correct?
Yes, the cervical spine.
Okay. And then below the cervical spine would be the thoracic spine. Is that correct?
Correct.
And the thoracic spine would be, and sometimes they're delineated as T1, T2, meaning thoracic 1, thoracic 2, all the way down to what, 5 or 6?
12.
I'm sorry?
12.
12. So
5 or 6 or 12, this is where just a little interjection of self-deprecating humor can make you not look like an ass. Um, but that being said, we will be stopping right here. Youngest Most Feral is reminding me that, we are on the time clock. Nothing like having. Uh, I did give him this job this morning because I can tend to be time blind. So I told him when it gets very close to 10 minutes before, you need to tell me, and I need to start wrapping up my stream. So he has given me the bat signal. Um, I will endeavor to be back on, and got some fuzz left over from the fake eyebrow. It's great. Um, I will endeavor to be on, and we will continue on with as much of the trial as we can get through before Shizzy today. Uh, when I get back, I'm just not sure when exactly we'll get back. So I anticipate around 3:30 to 4, but that is a ballpark guesstimation. So hopefully we will get back and start doing this, or we will start pretty we will have a shorter mornings with Mo tomorrow, and we will just plow through as much as we can. But that is the generalized plan. Thank you for hanging out with me. Good lord, what a strategy for a Monday, the second week of the trial. All of these witnesses together, I question the strategery in it. I will see you guys in a little bit. If not this afternoon, then definitely tonight on Shizzy's stream. Not sure where we're going or what we'll look at, but it's usually a hoot in a handbasket because we're together and it's hilarious. So I will see you guys there. Bye, you guys.